A 22-year-old man comes to the physician with an enlarged scrotum. He had received trauma to his groin while playing sports a day ago, but did not go to the emergency department due to not feeling any severe symptoms. The patient is concerned but is otherwise in no acute distress. Examination reveals a tense, enlarged scrotum, but no tenderness or erythema is present. Which of the following would most likely be helpful for establishing a diagnosis at this time? Choice A, checking the cremasteric reflex. Choice B, raising the enlarged scrotum superiorly. Choice C, palpation while the patient is standing. Choice D, performing a transillumination test. Or choice E, asking for the patient to cough during palpation. I'll wait 5 seconds and answer the question. So when you get these enlarged scrotum or scrotal mass questions, obviously the big one that a lot of resources tell you to look out for is testicular torsion, because it's the most important one in that it's the one that's the most emergent. But this patient is in no distress, he's not really feeling any pain, and this mass is described as a tense mass. So it makes it sound a little bit more like there's fluid in the scrotum. So that's why choice D, performing a transillumination test, is the correct answer. Now, in this case, the transillumination test can be positive or negative, because it's most likely either a hydrocele or a hematocele, where the hydrocele would be positive with the light passing through, and hematocele would be negative because it's blood, so it's harder for light to pass through. It is worth noting that in real life, after you perform this transillumination test, regardless of the result, you usually follow up with a scrotal Doppler, and that way we can more definitively rule out stuff like testicular torsion or some kind of direct damage to the testes. But transillumination is the best choice at this point. So let's look at some of the wrong answer choices here. Choice A, checking cremasteric reflex. Obviously, this is talking about testing for testicular torsion. And quick review, cremasteric reflex is where you stroke the inner thigh and then the ipsilateral testes will arise. It's mediated by an afferent nerve, ilioinguinal nerve, and then the efferent is the genital branch of the genitofemoral nerve. If the patient had testicular torsion, then the cremasteric reflex would be absent. But in this case, it's not really the first thing you would go for because the patient, like I said, isn't really in acute distress. And similarly, choice B, raising the enlarged scrotum superiorly. This is me describing the Pren sign, where you elevate the testes to differentiate between testicular torsion and epididymitis, where in epididymitis, usually the pain is reduced upon elevation, and in testicular torsion, it is increased upon elevation. And that's because in testicular torsion, the spermatic cord is kind of twisted up. So if you elevate it, if you think about a piece of string or whatever being twisted around and then you elevate it, that makes the coils even worse. So that's why in testicular torsion, if you elevate that testis, it's going to make it hurt even more. Similar to choice A, like I said, less reason to be suspecting testicular torsion here, so you wouldn't really pick this. Choice C, palpation while the patient is standing. This is referring to a test you would use for varicocele, basically an enlarged venous plexus in the scrotum. So the reason this works is because when you stand up, you will have more venous blood pooling in the inferior parts of the body, such as that enlarged pampiniform plexus. So that would make it easier to palpate those enlarged veins. Now, in this case, I already described the mass as tense and enlarged, so that doesn't really sound like a varicocele. The buzzword is always bag of worms, which makes sense, right? Because it's basically a bunch of veins or venous plexus and they're enlarged. So if you think about it, it might be shaped like a bunch of worms. Once again, doesn't fit the symptoms that you're given. Choice E, asking for the patient to cough during palpation. Obviously, this is talking about assessing an inguinal hernia, because an increased abdominal pressure from coughing would force the contents of a hernia to protrude, and then you can palpate for it easier. Not much to say there, right? So, bring it back. Enlarged scrotum questions, usually not that hard, right? You just gotta know your differential, and you gotta know some of the basics of each condition. Testicular torsion, it's really bad pain. You lose the cremasteric reflex, you can raise the scrotum to increase the pain. It's a medical emergency and you need to fix it immediately. You got varicocele, which is a bag of worms feeling, and it's because of an enlarged pampiniform plexus. Can be caused by various problems with the veins, but I almost forgot to mention one of the important things with varicocele is that you have it more on the left side than the right side, because the left gonadal vein drains into the left renal vein, whereas the right testicular vein drains directly into the IVC. So you can get stuff like nutcracker syndrome, where the superior mesenteric artery, SMA, compresses down on the left renal vein, and therefore you get a left-sided varicocele. So if they wanted to, they could tie this into stuff like renal cell carcinoma or something. Anyway, then we have what we have in this question, which is trauma followed by hydrocele or hematocele. It's fluid in the scrotum, so you just do an illumination test and you can follow up with an ultrasound. And with adults, it's usually from something like trauma, but it's more common in children because it can be caused by a failure of the closure of the process vaginalis, which is basically the tube the testes travel through to enter the scrotum in the first place. So it doesn't close properly and then get filled in with fluid. But that's the more nitpicky stuff, right? Hope you found this video helpful. See you in the next one.